The current event I selected discusses a proposed medical aid in dying bill in Florida. The article, published April 25th of last year, is still relevant as the state of Florida has not yet resolved the issue at hand. It features Lisa Patterson, a woman suffering from 2 different terminal cancers, who is lobbying for legislation that would allow psychiatrically stable adults with terminal illnesses to voluntarily end their lives. At this time, there are only 12 states in the U.S. that allow medical aid in dying, or MAID for short. In Florida, Lisa's home state, MAID is still illegal. Supporters of the proposed bill argue that patients should have the right to avoid unnecessary pain and suffering. Opponents of the bill believe that life is sacred, and that in some cases, preventing MAID protects a vulnerable population, a population that may have been coerced into requesting medically assisted death. This conflict is emblematic of the bioethical dilemma at the heart of all MAID cases. What must be considered first? A patient's autonomy, or the healthcare provider's obligation to preserve all life? All 4 main bioethical principles are evident in this case: autonomy, beneficence, non-malfeasance, and justice. Autonomy involves the patient's right to determine their own care. Beneficence and non-malfeasance states that healthcare workers, such as doctors and nurses, must relieve all suffering and pain, while simultaneously preventing harm. Justice, defined as a patient's right to receive treatment, is also in question, as patients who live in one of the 12 states that allow MAID can initiate treatment, while Lisa and other Floridians cannot. As a future psychiatric nurse practitioner, this topic may arise in my practice as I live in California, where MAID is legal, and I may be consulted to determine if a patient who is electing to initiate MAID has the decision-making capacity to make such a permanent decision. I may need to evaluate these patients to identify if depression, cognitive impairment, or other conditions are present and influencing the patient's judgment. This issue is very evident in the American Nurses Association Code of Ethics. Provisions 1, 2, and 3 state that the dignity of every patient must be respected, that nurses must commit fully to a patient's overall health and well-being, and that a patient's rights must be protected in an ethical and legal manner. Despite how a healthcare provider personally feels about medical aid in dying, they are still responsible for providing compassionate, unbiased care and ensuring that a patient is educated to allow them to make well-informed decisions. As states continue to debate this issue, healthcare professionals will continue facing complex ethical dilemmas that require the delicate balance between patient autonomy, state laws, professional ethics, and compassionate end-of-life treatment. Some discussion questions. 1. Besides a patient's psychiatric well-being, what other factors must be considered to determine if a patient is a suitable candidate for MAID? 2. If a state approves MAID, should the procedure be covered by Medicaid, or should MAID be considered an elective procedure and thus paid for by the initiator? Thank you for your time.